Guys Nation, welcome back. This is a solo cast, and I'm doing it a day after Father's Day. And I've been thinking about this a lot, about doing a reflection on what this day means to me. And you'll be asking yourself, how does this pertain to prevention over prescription? How does it pertain to healthy living? And I'll get there in a second. But when I think of Father's Day, obviously I think of my own kids and the dad I'm becoming and have been to my children, but I also think about my own father, and he's passed away over 6 years ago now. And despite having a bit of it was a rocky relationship. We weren't close by the time he passed. In fact, I probably hadn't seen him I've only seen him a couple times over a 10-year span prior to his death. But there was one lesson that he's given me, a gift that I haven't always leaned into, but it's always been something I think about when I think about my dad. And he always preached through his actions and what he wanted to instill in his children, that you be unapologetically yourself. You be unapologetically authentic and lean into your strengths, lean into your power, lean into what makes you you. And I've been thinking about this a lot lately because I feel, I don't know if restricted is a word, but there's times where you're going to walk on eggshells because of perception, because of how people are viewing you. And I'll tell you straight up, I don't give a fuck about what a lot of people think of me. I care about my circle. I care about my colleagues, especially, the stuff that impacts my job directly. But I've been personally feeling a need to speak up more, to be more vocal about some of the concerns I'm seeing within healthcare. I mean, you've heard me say this a million times. Healthcare system right now is in need. We need to shake things up. We need to be innovative. We need to think outside the box. We need to be there for our people, because on a daily basis, on a regular interval, I'm seeing the consequences of poor access, long wait times, being an unhealthy population. I see this daily as a clinician. And so what does this mean? Like, what me being more unapologetic about it? I feel like there's personally a need to be more vocal about some of this shit and to be part of the solution. To be not just, hey, here are some tips, but what are we going to do to help create that environment where our patients, our population is going to thrive? And so what does that look like? So number one, before maybe jumping into it, I also think in terms of vocalizing what our concerns are for the public, I think we need to ask more of our decision makers. We need to ask more that we are coming up with solutions. And part of that is, what metrics are we looking at? And I think I've always been one to say, hey, you look at your process metrics to make sure that we're going about it the right way. The time for that is beyond. Now we need to look at impact. What you're telling me, if you're in a position of authority, whether it's government or administration, your success at this point is on impact. Are you moving the needle? Are you making a difference in the lives of the people in your community and beyond? That's the metric. Because like right now, what I'm seeing still is like lollygagging. I see there's not much movement in terms of how we're going to improve this healthcare system. And so at a personal level, like when I look at people's health, so U.S., 87% of the population unhealthy. I really think there's an appetite for us to do more here. It's been amazing. The book being out, Prevention Over Prescription, I'm seeing people wanting to take their health seriously. I think we need to lean into that. What does that look like? It might mean people being more involved in health coaching. It might be asking more of our family docs to provide people with tools to be able to start eating better, moving better. It might be our government now subsidizing gyms and looking at ways that they could eliminate barriers for us to get healthy. Maybe it's intervening in our schools for them to talk about how we feed our children, the importance of exercise and getting our kids outside and moving more. Tons of ideas here, but the question is, Can we execute? And I feel like we can. I feel like there's momentum. And I gotta tell you, a lot of people they ask me like how do we take away these barriers? And to me, you get the people that are highly motivated to create change and provide them with sorry, my cheat sheet went away. So how do we do that? One of the main ways I think we could do that is fostering innovation. I know my team is sick of me talking about the need for us to be more innovative and create an environment for innovation. I think this is a ticket moving for in 2025, how we move the needle. This is a unique time where we have the tools at our disposal to improve access, improve knowledge, improve efficiency with the advent of generative AI, through large language models, through smart companies and that are doing really creative things, but we're not talking to each other. We're not creating an environment where we can take away barriers, where these smart people that have these solutions are talking to the people that are on the front lines that need these solutions. They're not talking to each other, not as well as they can be. This is why we created Lionheart, which you'll hear more about down the road. But I gotta say, after going to this web summit in BC, I'll just speak for Ottawa/Ontario. We need to do a way better job at fostering innovation. They're taking away barriers like crazy, creating an environment where people are talking to each other and connecting and doing some majestic things, teaching innovation to their medical students and to their trainees. This is not happening locally. So BC, Alberta, Nova Scotia is killing the game. But how do we bring that locally? This is what we need to do. People, they need this. Like I just think it's time. And maybe the last thing I'll tie into this too about this whole unapologetic side was that I get a little bit of heat. People are like, "Oh man, are you actually still training as are you still working as an ICU doc? Are you still like you see a lot of your content and all this shit?" I'm like, number one, people need to realize like I have a whole team that works behind me to create this content. So I could do about 4 hours worth of content or work within a month, or 4 hours of work, and that will be an hour's worth of content. Sorry, I'm saying that again. 4 hours worth of content that I'll sit down and do one or twice in a month. That'll be a month's worth of content. Team could help divvy up the editing. They'll help with the posting. They'll help with the blogs. I have a whole team behind me for this. So a lot of people, they're asking, "Oh, how are you able to prioritize the ICU and all this stuff?" I had a colleague the other day. He was saying this. He was saying he was working on his renovations on his time outside of work, doing his renovations, then watching some Netflix, then doing the things. You know what I'm doing while you all are renovating or watching your Netflix? I'm doing this shit, son, because it matters, because it's making a difference, because it's creating impacts. So I'm not sitting on the sidelines and just doing Netflix and chill. This is my mission. This is important shit, and I know it's making a difference. So all those motherfuckers that are judging and saying, "Hey, do you have time for this or that?" I do all of it. I do all of it. I pay a price by extending yourself, but I've seen the impact this is having on folks. I've seen the impact when they come to me and say, "Oh, my mom is no longer taking diabetic medication because of your message. Oh, my mom started taking creatine and is feeling stronger. I lost 5 pounds and I'm increased my lean muscle mass thanks to your message." This shit is making a difference, and we're just scratching the surface, folks. This is what my dad taught me. Unapologetically yourself. Stay authentic. Stay true to your mission. And I got to tell you, when you align like this, it feels good. It feels right. And I bring this energy to my real job. I bring this energy on the social side. And I'm hoping at a scale, this energy, this momentum, this unapologetic attitude will move the needle. That's why I show up. That's the lesson that my dad taught me. And let me tell you, when it comes to my own kids, as an ICU doc, you miss a lot of time away from home. Last Christmas, I was working. I was luckily able to be there for them, opening their presents. They know dad hustles. They know dad is on a mission to really reduce suffering and keep people out of ICU and get a healthier population. The one thing that like it gets me a little verklempt to think that they take these lessons away. They see the work ethic. I've seen them grind out when it comes to their sports, when it comes to their other tasks, that they see the importance of working hard. They see the importance of taking care of themselves and eating well. They come and tell me about how much protein intake they're taking during the day. They see it. They see the need to support others. Like one of the most, I get emotional thinking about this. My middle son, who's got the softest heart, I think. I was late to this fundraiser for the Boys and Girls Club of Ottawa, and I'm trying to run out the door, and he's like, "Where are you going?" And the Boys and Girls Club, and he's like, "Hold on a second." I'm like, "Marlo, I gotta go." And he runs up and he goes into his piggy bank and gives me $5. He's like, I want to help. I want to support the kids in the community. And when you put in that time, it's time away from home and your kids see you and they see the importance to support others, and they're going to carry that with them as far as I could say the rest of their lives. That's powerful. And that's the power of being unapologetically you, yo. And so all this to say, it's probably a bit disjointed pod, but we're going to show up our best selves now, folks. We're going to continue that message. Unapologetic leadership, unapologetically ourselves. We are going to keep pushing that message of getting healthy and doing what we can through an innovation lens, through the book, through coaching, through products. You got Guide to Nutrition, all about healthy living. And if you see a lot of me, good. That means we're doing our job, because it's this message more people need to hear about. Thank you for listening, and we'll connect again real soon. Peace.